All right, well, thank you everyone, and nice to have you join us today. Welcome back to the Southern Learning Community for the ASAP project. Today we're going to dive a little bit deeper into one of the topics that I know a lot of states are grappling with now that with social distancing guidelines and a lot of office staff and state staff working remotely or not able to allow as many people into offices as they used to. That's presenting new challenges and also opening up some new opportunities for the way that benefit applications are received and processed. So today we're going to first hear from Jen from CBPP, who you all know, with some key things to think about and some examples. And then we're going to be joined by Maurice Prestes, who is the Assistant Director for Eligibility Services Division with the state of Utah, to give us an overview of how they have worked with their employees being remote for a number of years and kind of what that looks like from their end. And then we hope to have a robust conversation. So as you hear the presentations today, please type any questions you have into the chat feature on the webinar, and we will be sure to collect those and then get the discussion started with those at the end of the presentations. So with that, Jen, I will turn it over to you.
Great. Thanks, Suzanne, and thanks everyone for joining us today. So as many of you know, there's been a long-time movement within state agencies to create more remote access to benefits, online applications, phone systems, and such. Never has that been more important than during the current crisis, when regular operations are disrupted the way they have been. So today we're going to talk a little bit about ways to make sure that populations, especially vulnerable populations, are able to access benefits during this trying times, and some things for you all to work with your state on in order to improve that access. So first, let's just take a moment and kind of look at the current situation and where we are. It truly is a whole new world. And for those of you who have been watching a whole lot of Disney Plus with your kids, brings up interesting images. Not quite as great as Aladdin. But right now, the current situation is not great. You know, eligibility offices and providers have closed their door to in-person assistance. And that's really affected how people are accessing help. Staff are working from home, both at community organizations and for many state agencies. Sometimes they've been doing that for a long time, but in many cases, this was a sudden shift for people that's really affecting the way that the agency does business. And of course, there's a huge surge in need as we're seeing unprecedented unemployment numbers and people from many sectors being dramatically affected by the current crisis. Fortunately, there are a number of waivers and flexibilities, both on the SNAP and Medicaid end, that are helping states manage the current demand. But of course, they're temporary and aren't going to be around forever. But that is really changing the way things are happening right now at the state level. Looking ahead, this is not a crisis that was going to be a few weeks or even a few months long. That's how it looked. You know, that's how I kind of thought of it as first. But it's clear that this is going to be happening for a long time. Even if something dramatic happens with the coronavirus itself, we are looking at a severe economic recession. And drawing on lessons from the past recessions, we know that that's going to generate a huge increase in demand. Unfortunately, that's going to happen at the same time that state budget revenues. State revenues are going to be dramatically reduced, and they're going to be resulting cuts, possibly to programs, possibly to IT budgets, very likely to staff. And that's going to also tremendously impact operations. There's going to be continued social distancing of some form within state agencies as well. We've heard some offices say that they're not opening up until 2021. Don't know if that's actually going to happen or not, but it's not clear when eligibility offices are going to open up again and what those operations are going to look like. And finally, those temporary waivers and flexibilities that we mentioned are going to expire. And states are going to have to deal with a lot of the case maintenance that they haven't had to deal with right now. Renewals, changes, and things like that. That's going to add a lot of workload on top of the increase in application volume. So it's really important that we look now at how things are going and how they need to change as we look ahead to these oncoming challenges. So let's talk about how people typically apply for benefits. Traditionally, they do it in person, walking into an eligibility office. They do it by mail or by dropping off an application or forms. They do it online or through a mobile app, or they do it over the phone. So the in-person avenue has been largely shut down. Now, in some states, there's been a long time movement away from in-person services with enhancements to the online and the phone systems so people no longer have to come in. And that's great. But in other offices, there is still a tremendous in-person volume. And that's really important for certain populations who lack internet access, might be limited English proficient, and need to really kind of interact with people. In addition, that's usually been the fallback for people. They might try to apply online, try to get through over the phone, but if push comes to shove, they could go and sit down in an eligibility office and wait for 6 hours and actually finally talk to a caseworker. Not ideal by any means, but it was a fallback option to get service that has been largely shut down. The next option of mail or dropping off an application is still available, but more challenging than before. The first issue is getting a paper application. While it's available online in most states, people may not be able to download it. They may not be able to print it at home. And some of the typical avenues of maybe going to a library or going to a social service provider to pick up an application are no longer there. If they can't get an application, how do you submit it? Some offices don't have drop boxes or other avenues to quickly get that application to the agency. And finally, what's happening on the agency end? Are they checking mail drops and drop boxes regularly? How has the pandemic affected their operations with regard to scanning? Are there backlogs in scanning applications as they come in, or other kind of paperwork processing issues that are affecting the mail or the drop-off route? So those are a few considerations for those first two, and then we're going to spend most of our time looking at the online avenue and the phone avenue. So let's take a look at online applications. That is an available avenue in all states in some way. So all 50 states do have an online Medicaid application, 46 have a SNAP application, and about 40 have a TANF cash assistance application. So it is there, but just because it's there doesn't mean that people can actually use it and access it. So there are a lot of considerations when we look at how usable it is. First of all, does the household have internet access? The pandemic is exposing the real consequences of rural areas and other folks that don't have good internet access. Well, even if people don't have broadband, most people use their phone to access the internet. So is that application mobile responsive? And that means that people can actually access the website on a mobile device, and it formats and patterns itself in a way that's actually usable. It's not a mobile app necessarily, but it's just when you pull up a website on your phone, you can actually use it. I encourage you, when you have a moment, to take a look at your state's online application and see what the experience is like on a phone or on a tablet. It's never going to be great because the fields are going to be kind of small, but there's a big difference between a website being mobile responsive and not. What is the account setup process like when somebody goes to apply online? Sometimes you don't have to do any sort of a registration. Might just require a username and a password. Other applications require an email address, username, password, security questions, confirmation that you're not a robot, and a PIN number. And when that many steps must happen before you actually begin the application, it can be a big barrier to people actually going through and completing that online application. Similarly, some states require remote identity proofing. And this is when you enter some basic information about yourself, and the system comes back with some kind of security questions that are usually based on your credit report. So things like, you currently have a mortgage with which lender? You may have had a car loan in 2014. What was the approximate amount? And these applications are challenging in general. I have failed a few in my time. But even more challenging when you don't have access to records readily available to check things like that. Sometimes they're phrased in complicated ways that people may have difficulty understanding and accessing correctly. And for many of the population that we serve through SNAP and Medicaid, people have limited credit histories, whether it's because they're young, have limited work history, are recent immigrants. And in those cases, the system cannot even generate questions for them to answer. And they're therefore barred from even completing an application online. So that can be a huge challenge. And then, of course, there's a consideration of how many screens somebody has to go through to actually apply. How much time does it take them? Which can be very challenging and lead people to fall off partway through or get discouraged and not actually do it. So there are a couple of resources here listed. One is a Code for America piece on bringing social safety net benefits online, and that actually goes through every state's application, online application, and looks at some of these factors. And the next slide shows how your states rank or how your states come out on these different factors. They also have a piece on mobile first and how states should probably shy away from developing a separate mobile app and instead make sure that their websites are mobile responsive and can be used on mobile devices. And then we have 2 papers at CBPP in partnership with NAVA, looking at both user experience with SNAP and Medicaid systems, which has to do with that account setup and login procedure, and then another one focused on remote identity proofing and when it is actually required. So looking at how each of your states stack up on these different factors, and this is based on that Code for America report that I mentioned. So only 2 states require remote identity proofing for the Medicaid or combined application. And that's worth looking into because the scenarios in which RIDP is actually required by federal regulations and by CMS are pretty narrow. And most state applications do not meet those requirements, and therefore it's unnecessary and can be a big barrier. Pretty split on if applications are mobile responsive or not, but that can have a huge impact on access. Most states do require some sort of registration in order to complete the application, and that's really worth looking at. Again, if it's a username and a password, that can be kind of a pain, but it's different than email address security questions and all of these things. Another consideration with a registration is if that's linked to ongoing benefits in some way. Many states also have a system where you can complete renewals or to report changes online. And if doing registration at the application, then it allows you to go back in and make some of those changes later on with that same username and password, that has some benefits. But in many cases, the 2 kind of sides of the system are totally separate, and that username and password doesn't get you very far that you set up for the application. And finally, looking at the number of screens and how many minutes it takes to complete the application. You'll see we have a wide range, going from 24 screens to 73 screens, and minutes ranging from 20 to 120. Now, obviously, it depends on if it's a combined application or not, how complicated your housing scenario is, and some other factors, and how many questions. You can have 1 screen, but it has 12 questions versus 1 screen containing 1 or 2 questions. So these are just kind of relative things that it's worth comparing to other states and getting a feel for where you stand. But it really should give you a little bit of an image of what it's like to actually apply. And I know that many of you have actually gone through that online application or regularly help clients and see these barriers. But it makes a big difference on whether that online pathway is usable to clients or not. So next, let's talk about the phone applications a bit. So first, calling the agency in general. What's that experience like? Well, one consideration is wait time. And that's really important with limited minutes on cell phones and high demands on low-income families' time, especially right now. But wait time should not be a be-all and end-all. In many cases, states can artificially lower the wait times by having somebody just pick up the phone. That person can't necessarily help you. They route you to another queue, take a message or something like that, but they can look like they're being responsive and answering the phone right away. What I think is more important is whether the person who answers the phone is actually able to address your issue. If it is a caseworker or somebody who can take the requested action. I personally would rather wait 25, 30 minutes to get in touch with somebody who can do what I need to, change an address, take an application, whatever it might be, rather than have the phone picked up right away, but somebody effectively take a message and pass it on to an overwhelmed caseworker who may or may not actually take action. Another consideration with phone systems is what the interactive voice response, the IVR system, is like. That's the phone menu that you have to navigate through when you call. Sometimes it can be very helpful, sort you in different queues. Sometimes it can provide valuable information about the office status, about your benefits or your application status. Those by their nature are kind of a nightmare, but it's definitely worth looking into and seeing what that is like. Again, I encourage you to call if you're not in the practice of regularly calling the agency, to just call and see what it's like to go through that. And finally, does the state offer a callback option where it might say that we have high wait times right now, we'll keep your place in the queue and call you back when it's your turn. People may or may not trust that. I tend to be hesitant to take that option myself. But when you have limited minutes and other things happening, it's really important to be given that option to save the time of waiting for 45 minutes or whatever it might be. And again, another factor with wait time is some agencies are so overwhelmed that you're not even allowed to wait on hold. It says, we're too busy, call back another time. And that's incredibly frustrating and disempowering for a client who can't even wait and get service. A few considerations about what the call center operations are like in your state, or what they could be like as you look to the future. So some have a brick and mortar call center location where all the call center staff are located in a single building. Others, it's more virtual, where caseworkers are spread at different offices around the state, but all connect to the same phone system and together formulate and staff the call center. And nowadays, more than ever, it might be made up of remote staff who are dialing in from home, possibly through kind of a landline connected into the system or through their computer, possibly through a personal cell phone, or whatever it might be in this current time. And that just, there are advantages and disadvantages to each setup, but that can kind of affect how other things fall out. Is there a single state phone line, a 1-800 number, something that people call in order to get information about SNAP and or Medicaid? Or are there multiple systems? You have to call each office separately, or are there different numbers by regions? Does the state use some sort of a call center software like Cisco Command Center or other things that help set up queues, IVRs, monitor wait time, and other things like that? It's generally off-the-shelf software that any call center in any industry might use, but it allows a lot of different features to help make the call center more efficient. Does that integrate with the eligibility system so that somebody can inquire about case status and get information back about their status? Or if you enter some basic information and are routed to a caseworker, does your case automatically come up for them when they pick up the phone? So different features that are allowable there. And finally, what are the staffing roles? Is the phone being answered by a caseworker who can actually change the address, take the application, or do what needs to be done? Or is it staffed by somebody else who isn't empowered to do those things and ends up just kind of, either filling out an online application on your behalf rather than, doing the interview and actually processing it in the application while you're on the phone, or somehow taking information and passing it on to a caseworker where the client doesn't really know what happens with that information in the end. So these are just kind of some considerations when you look at what the call center is like and what it could be like. Now, one of the main issues with the phone application is a telephonic signature. And this is applicable both to when an agency is taking an application over the phone and when a community partner. And just to be clear, I mean SNAP or Medicaid agency, whether it's a state or a county, taking a telephonic signature versus a community partner, a food bank, a social service organization that's helping somebody apply over the phone. So when the actual SNAP or Medicaid agency is taking a telephonic signature, they have to be conscious of the fact that both FNS and CMS require an actual recording of the signature. So the client has to, assent to their rights and responsibilities, say that the information they provided was true and correct, and the state has to make an actual file, record that information, and somehow attach it to the case. Now that's been longstanding policy from both FNS and CMS. FNS has issued a waiver for state agencies due to the pandemic that's currently valid through June 30th. It was valid through the end of May. It's been extended through June 30th. And this allows state agencies to document that the client assented to their rights and responsibilities, but it doesn't require the recording. And that's important for folks who are suddenly remotely working and may not be able to dial into the formal system and make that recording the same way they could if they were on site in the office. CMS has not issued a formal waiver for Medicaid agencies. Some states are kind of going forward and applying a similar policy to what's being allowed on the SNAP side, but there is a little bit of a lack of clarity from CMS right now. There's also an issue of how much needs to be recorded. Some states, usually legal staff, are saying that either the caseworker or some automated system has to read out the entire rights and responsibilities and record that and record the client saying yes to all of that. That is not required by federal law. The federal guidance from CMS and FNS are not very specific on how much actually needs to be recorded. They generally say that you don't have to record the entire application or interview process. But you can see everything ranging from that full-on reading of rights and responsibilities to a client saying, I confirm that the information I gave was true and correct, and then they say their name or something like that. But that's worth looking at. There's an in-between where the client, listens to, I will not sell my benefits, I will not trade them for guns, and, the silly rights and responsibilities associated with SNAP. I have given information that is correct, all of that, that can be kind of an abbreviated process that allows the whole interview to go, or the whole application process to go forward. Just a reminder that if an application over the phone can be combined with the interview, everything can be done in one touch. And the idea there is that when you're applying with a caseworker and they're entering the information into the caseworker-facing system, they're effectively interviewing you at the same time. And if they can electronically verify your eligibility, they can actually certify the case at the end of the call, let you know how many benefits you get, and everything can be done while someone's on the phone, which is the ideal process. And finally, these things can be used at both application and renewal. So somebody who needs to renew SNAP benefits, for example, could call in, complete the renewal form effectively over the phone with a telephonic signature, and do the interview with the caseworker at that time. And the whole renewal could be done in one shot in that format. So as states will have to begin doing renewals again in the near future, that's something to consider as well. Now for community partners that might be helping somebody apply, previously they often interacted with somebody in person and might have filled out the online application with the client sitting right there next to them. Now they're in a position where they're helping people over the phone a lot more. And in most cases, the community partner is actually filling out the state's online application, but doesn't have the person right there to either make them an authorized representative or to physically click submit or something themselves. And so SNAP has allowed this to happen for a long time, but they typically require the community partner to also make a recording of the client assenting to their rights and responsibilities. It didn't necessarily need to be submitted along with the application. It needed to be retained by the community organization and accessible by the state. But that's increasingly complicated as partners are facing the same challenges that agencies are facing. And so there is a COVID waiver available that allows the agency to also document that the client agreed to their rights and responsibilities without actually creating the recording. And for Medicaid, there is a temporary waiver that says that community partners can take an application and submit it online without a physical or recorded signature. In most of those cases, it does require that that the client designate the person as their approved representative or their authorized representative. And that has some other authorities associated with it that can be dangerous for the client. And so wherever possible, you want to make sure that anybody who is doing this on the community side is well trained, recognizes SNAP rules, Medicaid rules, and can serve effectively in that role, rather than putting the client at risk by submitting inaccurate information or other things. So that's worth considering as this kind of community partner role may take off. And just wanted to touch on the idea of verification documents as well. So applying online is one thing, or applying over the phone, but if a lot of verification documents are required, that can really inhibit a application actually being approved. So the first thing to look at, as we've discussed in past conversations, is to minimize requests for information, to use policy to increase acceptance of self-attestation, in Medicaid to use things like an effective reasonable compatibility policy, or to rely on post-eligibility verification. We enroll somebody based on the attestation on the application and don't conduct the verification until they've already been enrolled. And wherever possible, maximizing electronic data sources to verify information rather than requesting paper documents from the client. If a document is needed, how can the state simplify submission? Allow them to mobile upload, to use their phone to submit the document, or to email it in directly to a caseworker so that it gets there very quickly. And finally, to apply a liberal good cause policy if those documents are unavailable. In the Medicaid regs, there is a disaster exception that allows a state to waive documentation on a case-by-case basis if verification is unavailable. And there's, of course, long-standing SNAP policy that requires the agency to help obtain verification and to use the best available information in a situation where documents are unavailable. So how does this all come together in your state? Well, how are these different pathways working right now? And one way to look at that is to look at some data. So the first could be to look at total application volume. We would expect in most states that application volume would be increasing right now. Now, one thing to consider is that there are waivers of renewals in SNAP and the continuous coverage provision in Medicaid that prohibits terminations for Medicaid cases. And so what that means is we're not seeing the churn we normally would. So every month, a certain percentage of the applications the state receives are people who were on 1, 2, 3 months ago, got cut off, and now are reapplying. That in general is not happening right now because people aren't getting cut off. So that could drive the application volume down slightly. But at the same time, we're seeing this greatly increased need, people applying for unemployment and all of this stuff, which you would expect to make the application volume go up. So that's one thing to look at. And how are those applications coming in? Is there a significant increase in online applications? Is the phone application available? How is that comparing to a mail or in-person submission, which previously was available and may or may not be available right now? Then looking at enrollment data. In general, we should see enrollment going up because, as I mentioned, the SNAP and Medicaid cases should not be being canceled. So that should, keep those people on, and then additional folks are probably enrolling because of the pandemic. And so to monitor those numbers and really see what's happening in your state. In many cases, April data is available or coming out now, and that's really when we're seeing the first uptick in these numbers. And we'll have even more information in the coming weeks. Looking at that, it's important to identify who's being left out. It might be seniors, people with limited English proficiency, those living in rural areas, or in general, those without internet access or sufficient phone minutes. Is there a way to see, either through the data or anecdotally, that there are populations that are unable to access the system right now, unable to apply for benefits, who are really in great need? And what are the options available, either on the outside through your communities, or things that the state can do to make sure that those folks are reached and have access to benefits. Now, in general, as advocates, we need to really shift out of crisis mode. The first couple of weeks with the flurry of waivers and activities and major operational changes for the state were a crazy time and required a lot of understanding and flexibility for clients, for advocates, and for the state. But it's becoming clear that there are going to be very long-term impacts of COVID on operations, on staffing, and on demand. And so we've got to look at that long-term picture and see how we want the system to look in this quote-unquote new normal. And I think it really is reasonable to request bigger changes right now, like making your application mobile-friendly. But it is necessary to prioritize. I think at the end of March, early April, if people were pushing things like that, we might have said, whoa, give the state agency some slack. They're dealing with all these waivers, major operational changes and things. They can't do something like that. But now recognizing that we're going to be here for a while, it's worth pushing the state to make some of these significant changes that could have a big impact on access. And frankly, it might be worth pushing them now, while there are still some flexibilities and waivers available that give them some workload protection before they get crushed by completing renewals and increased application volume and everything that's going to likely be coming in a few months. And frankly, this crisis provides an opportunity to really leverage the moment and to focus on vulnerable constituencies. If you're able to identify that seniors or others are not able to access benefits, that's something that you all know you can make us think about, you can get some attention to. And look for the governor's office or the agency leadership to support you in getting over hurdles. Even if the hurdles aren't created by COVID, maybe you've maybe for a long time you've had remote identity proofing preventing people from using your online application, or not having it mobile friendly, or having it take 120 minutes to complete. So how can you say right now, okay, these people, this is their only way to actually access benefits, they're in great need, this is a hurdle, we need to overcome it. In some cases, it is legal or tech folks that are saying, nope, we need to do this, we need to make this barrier because we need to be 110% secure at all costs. Well, that calculus is changing right now as people are hungry and need medical care. So if you can get some buy-in to making those changes and having them say to IT or say to the legal folks, find a way around this, find a way to make this accessible, now is the time. And finally, what can you all do just to document what's happening? Are these modifications to operations, to policy, are they increasing access or hindering access? How is it all playing out on the ground? What data or stories can you collect now to help move your advocacy efforts forward in the future in this area around policy and operations? So those are a few considerations. At this time, I'll hand it back to Suzanne to introduce our guest from Utah.
Thanks so much, Jen. Before we move on, we did have one question come in for you that I think we'll just handle now and then move on to our next presenter. The question is, what about CHIP And also, does the Medicaid waiver for community partners allow them to take verbal consent for application or enrollment assistance by the community partner?
I'm not sure exactly what the context is for the CHIP question. If it's MOE, the MOE provision that prohibits states from terminating Medicaid coverage right now does not apply to CHIP. So CHIP cases are still subject to renewals and other things. How states are actually handling that differs. Some are just not being timely, and kind of explaining to CMS why they're not being timely, and kind of getting away with not doing renewals. But fundamentally, that law does not apply to CHIP.
I think the question may have been around the telephonic signature.
Oh, gotcha.
Point.
I believe that's for CHIP as well, but I would have to double check. And yes, the idea of the verbal consent for Medicaid partners, yes, there's a question in the FAQs about the Medicaid FAQs that they've been putting out, that CMS has been putting out, that says, can a community partner assisting a client over the phone, take their verbal assent in order to submit an online application on their behalf. And CMS is allowing that to happen right now during the pandemic.
Great, thank you. And just a reminder to everyone as we move on, I think I said at the beginning to put your questions in the chat box, but that was a mistake. There's a question box that you can put questions in. So as you have questions come up, please put them in there and we will get them out to the presenters. Next, I'd like to introduce Maurice Perses. He is the Assistant Director for Eligibility Services Division with the state of Utah, where they have successfully worked with remote employees from their state offices long before the pandemic. So he's here today to share kind of how Utah undertook that change and how they serve their customers with their staff working remotely. And with that, Maurice, I'll turn it over to you and I will unmute you. So you should be able to speak.
Okay, thank you, Suzanne. Can you hear me okay?
Yes, we can.
Wonderful. Well, thanks for having me, first of all. And I do apologize for not providing any visual stimuli for everybody that's on this call. I just hope that we can have a really robust conversation. I can answer a bunch of questions that might be of interest. Before we get into those, I'd like to just give you a little bit of background information about how we do things in the state of Utah, which I believe will be helpful as this conversation progresses. So let me do that quickly for a few minutes, and then we can tackle questions, or I can focus on anything you want me to cover. I didn't want this to be a presentation that covers topics you might not be interested in, so let's focus on what you guys would like to hear. With that being said, let me just kind of give you a little bit of background. I'm an assistant director over systems and policy, so I currently oversee our policy and our EREP system, which is the system that we have developed in-house that we use for eligibility and enrollment in the state of Utah. Eligibility Services is one of the many divisions that are under the umbrella of Department of Workforce Services. We are the biggest division within it. Other divisions that are under the DWS umbrella are Unemployment Insurance, Workforce Development Division. That's also, some of you might know them as like Job Service, Office of Child Care, Office of Refugee Resettlement, in Office of Housing, just to mention some of the biggest ones. We are an integrated system. We administer Medicaid for the state of Utah, although this is one of those programs that we are an eligibility folks, meaning we determine eligibility for Medicaid, but we do not own the policy. The policy in our state is owned by the Department of Health. However, Department of Workforce Services administers eligibility for all programs. We also administer SNAP, we administer child care, and we administer financial assistance. For all of these programs, we use one application that offers all those options that were previously mentioned. We currently have roughly about 180,000 cases, and we perform eligibility functions with roughly about 800 staff. Our budget is $57 million annually, for those that might be interested. Prior to the pandemic, we have about 200 staff working from home. Currently, about 90% of our staff work from home and have been doing so for the past 4 weeks. As we started doing eligibility, we are, as a division, we're about 11 years old. We started this with a DOS-based system, and like I said, about 1,000 to 1,050 employees, $80 million budget. Today, we're handling about 180 cases with 800 staff, and our budget is $57 million. Today, our ward looks like we have an EREP system, which is something that we've developed in-house. We have MyCase, which is a window into MyRep, or that portal that we talked about that allows customers to do many things. We do electronic verification today, meaning we try to minimize the number of things we request from customers. We try to verify everything electronically. We have found that to really help us with how quickly we can, how accurately we can process applications. We are a statewide model, meaning what applies here in the Salt Lake area where I'm at also applies to anywhere in rural Utah. And anybody that's going through the process will go through the same process here in Salt Lake as they would anywhere else in the state of Utah. We have case ownership, meaning our case managers own the cases that they process. They are assigned to them. We have something called hierarchies, and that's just basically how we're organized based upon what you have in terms of programs on your case is shipped to a specific hierarchy that has specialties that processes those cases. We can talk about that because I know that sometimes can be a confusing topic, but I can talk about that if needed in depth later. And then we are a call center. We, in terms of application processing in our call center, we do function out of offices or employment centers. We have staff that work in job service eligibility centers. We have typical call centers, and we have staff that work from home. Like I said, about 550 out of our 800 employees are actually folks that do eligibility. Everybody else is in supporting functions. And out of those 550 folks currently today, we have 85% working from home. I'm just going to talk a little bit about the application flow for us, how that goes, and before I open it up for questions or whatever topics you want me to cover. As we receive an application, first let me mention that we have had the MyCase portal. We were one of the first in the country to implement this, although Florida does keep arguing that they may have been first. Either way, I'm not going to get into that argument, but I'm just going to say we've had a MyCase system for about 6.5 years now. And we actually allow customers, we receive about 60% of our 2/3 of our applications are received online currently. When an application is received in the state of Utah, because we have one application for all programs, our system does a verification check. After we register the programs, it writes all that information to our system. Once that is done, the system will then perform a check to see what programs the customer is applying for. Once that is completed, the application is then routed and assigned to a worker in the appropriate hierarchy, which is something I mentioned earlier. And then the customer is either, if they're applying for SNAP, they're instructed to complete the telephone interview. Once they are completing that interview, because the case has been assigned to an eligibility worker in a specific hierarchy, that call is transitioned to the hierarchy where the case resides. So the people that are answering phone calls are actual eligibility workers that can answer questions to that case specifically. And as they process that case, once the decision is made, the case will remain with that worker. Now, as far as the call center goes, when we receive phone calls, because it's a hierarchy, you don't necessarily talk to the caseworker that's assigned to the case. You talk to the individual that's an eligibility worker in that case covering phones for that hierarchy and has the specialties and ability to answer any questions that are on that case. Our application flow has been this way for the last 5 years or so, I would say, and we are just been fine-tuning it. We are very happy with the way that's been functioning, so we're just fine-tuning it currently. As far as our staff go, they are measured on a couple of things in terms of their success. One is case accuracy. The other one is the number of determinations they make, so quality and quantity. And then we also measure backlog in terms of how quickly they process applications and how quickly they process tasks like application changes or the address changes, etc. That's basically how our application flows. I know there's a lot of questions, so I'll just open it up to things that perhaps you want me to talk about in depth, but that's just some background information so you guys have an idea of how we do things.
Great, thank you so much, Maris. And as a reminder, submit questions through the question box through the GoToWebinar portal. Maris, I was hoping you could, I think you mentioned that due to the pandemic that we're currently in, you have more staff perhaps operating remotely or from home than they had, but can you dial in a little bit more on if there have been other changes you guys have made in response to the pandemic that has allowed access to applications to continue to be as widely available as possible?
Yeah. Most things that we have done in the past remain unchanged. The options that we offer to folks are you can apply online, which is what majority of our customers do. The other thing that we do also is when a customer goes to MyCase or if they go to the office to complete an application, we do tell them that if you choose to complete an online application, it really helps expedite your case. One, the application that's being submitted is prompted to be completed. The other is if you're filling out a paper application, things that you miss fields, not being able to read what the customer has put down, all those things kind of affect processing timelines for us. So for us, the online portal has been really something that we use heavily in terms of applications. We're in the process of designing a telephonic way to submit an application. This has been a question that has come in for those that are having a hard time moving around, don't have an internet access. We currently, if you are completing an application and none of the options that are available, meaning if you don't want to do an application online, if we can't mail an application to you, if you can't come to the office, we offer, as a measure of last resort, we offer the ability to apply telephonically. The way that goes is that entire call, as it comes in, as a customer to our IVR system, puts in an option to apply via phone. They are routed to our CSR team, which is our folks that answer or support our chat option in MyCase, as well as take these applications at times. And all of their calls are recorded. So as what we allow customers to do now, if none of these other options that I talked about work, you can choose the phone application. And we have been doing this for the last 4 weeks or so. We have currently only taken about 30 of those applications, and apparently I was worried that it might be overwhelming for folks that are working in that group, but it really has not been. It appears that most people are still resorting to online applications and other venues. The other things that we had to change to allow people to work from home is we've had some issues with our IVR, our phone IVR. Our phones do route to appropriate folks, and as they were working from offices, what we quickly had to do is we had to utilize technology to have those phone calls work with the IVR system and come through their cell phones. We were able to establish that about 4 weeks ago, and the phone calls are actually working as they have in the past, not through their office phone, but actually through their cell phones.
Great. And I was just curious, do you know through all the online applications that you receive, how many of those are coming from a mobile device versus, an actual computer?
That is not something that we measure. Our application is mobile friendly. It does take, we totally ripped off TurboTax. I can't believe I'm saying this in a recording. We've actually been inspired by the TurboTax model, and we've flattered them by saying that, oh, this is the way we can actually do applications, and that's what kind of there's a look and feel of TurboTax to that whole process. We have not had any issues with applications and customers stating that it's taking a very long time. Today, if you're applying for multiple different programs, it's roughly about 30-minute process, and we reuse information that we have used for one program and apply to the other. Did I miss a part of your question? I believe I have, Suzanne.
No, I think that covered it. So the next question we have for you, so we've heard from some other states around the country that during this time of the COVID pandemic, when offices have been closed, it's created a particular barrier for people who speak a language other than English. Can you talk a little bit about how you ensure access online or telephonic through for people who speak, any language?
Yeah, and that's a little rough, and I think that's a challenge for everybody that's in this. Meaning there's a need for hundreds of languages because we resettle refugees, and we're glad to have them too. But and we have Office of Refugee Services, so we utilize their assistance because they have a lot of folks that are on site that speak those languages. Our system currently offers everything in English and Spanish currently. If you are a different language speaker, what we do is we encourage you to call us, indicate what language you speak, and then we get an interpreter on the line. In terms of obtaining in-person services like completing an application, so for example, if you're looking to complete an application and you're speaking a different language, you can do a telephonic interview. We will then contact an interpreter and help you out. If you're looking for help in person, our refugee office still remains open. So they provide assistance with multiple languages, and folks are still able to get assistance through those means. And then community agencies, you've heard it mentioned that some community agencies are completing applications for customers. So we're working with those very closely to ensure that we're allowing for those things to happen in these times. So some of these are, we don't have all the answers, but we try to make things work. And I think languages is probably one of those biggest barriers, but with interpretive services and community services, I think we manage.
Thank you. And then the next question is, so on the line for the audience here, we have state advocates today, and a lot of the states, as you saw, are kind of in different scenarios in terms of their online applications, how long they take, or how many pages there are, or perhaps even if there's an online application available. If you were to give the advocates advice about, one or two things they should really ask their state for in order to improve accessing benefits remotely without being able to walk into an office, what do you think are the top few things they should focus on?
A couple of things that I would recommend is reduce duplication and try to reduce the number of documents that you are requesting, meaning we administer about 90 different medical programs, SNAP, childcare, and for the most part, when you're talking eligibility, we're requesting the same stuff. There are things that we care about, such as citizenship, household composition, income, assets. Those are things that most of the states can get information on online. Long gone are the times where you complete an application and we send you a verification checklist that has 20 items on it for a person to provide. We as eligibility folks like to over-verify. We've gone through an over-verification process ourselves and tried to reduce that. What we have found out is the best notice that we can send to a customer is the notice that never goes out, because we haven't figured out notices for the states for the most part. And most of the times when we do send notices, we confuse customers. And sometimes we send a lot of unnecessary notices as well as unnecessary verification. So if we're talking about what we should focus on is reduce duplication. And one thing that we have really found out that has been a driving force for everything that we do is timeliness for us in terms of measurements and eligibility is equally as important as accuracy. Let me kind of give you an example. We used to focus on accuracy and have lost sight over timeliness. And we've contributed to our timeliness by requesting too many verifications, waiting for stuff to come back. As we've gone through this process, what we've been able to do is we've reduced our timeliness. We've been able to reduce the number of phone calls that are coming in and subsequently the amount of time that a person's spending on the phones. So if you can reduce your timeliness, then the need for the phones is not going to be that great, and you can focus on the things that really people need us to do, which is make eligibility decisions. So reduce duplication, reduce the unnecessary requests for documentation, and then focus on timeliness is the things that I would suggest.
That's great advice. And we have one more question. I'll remind people if you have additional questions to put them in the question box. Next question is, when Utah originally transitioned to having some staff work remotely, what were the biggest barriers to that and how were those overcome?
I think the biggest barrier in not having an employee right there in front of you is trying to make sure that they're being productive and they're doing their jobs. What we've had a telecommuting system in place for a number of years. In order for a person to be approved for telecommuting, they have to meet some enhanced performance requirements before we will approve them to go telecommuting. But the things that we have focused on is really the performance plans and being really clear about what the expectations are. Like I mentioned, there are several things that we currently measure, but I think that was kind of the difficulty. Are you spending the time on the phones? Phone adherence is something that we measure currently. We measure the number of applications that they process in a day. We look at the number of tasks they do, but things that we really put on their performance plans, which I think is what has enabled us to send people home, is really defining those performance plans and telling folks, if you end up going home, these are the expectations that we have of you, and they include an element of accuracy, element of timeliness, and element of the amount of production that we expect to those folks. And focusing on those, as saying these are the minimum expectations. The other thing that we do is we have a robust ASI, annual salary increase. We do performance increases annually. And what we do is we use those same metrics to give people ASIs as well. So I think the biggest issue in sending people home is making sure that you define a performance plan and accountability in those. So performance plans, I think, are the biggest thing that we currently do in order to ensure people can function from home.
That makes a lot of sense. Were there any like technological barriers that maybe you guys had to overcome that states may be grappling with now if they're, using remote staff for the first time?
Yeah, one of the things that I think everybody's worried about in terms of risk planning is how secure can you keep your data? Meaning, can somebody go from home, plug an USB into their port and create a list of whatever, end up using that data? We've gone through the process of providing a lockdown station. We call them thin clients that have limited access. We also monitor their access after hours. We have exception reports that say, hey, this person has maybe accessed a case that has the same last name, and we clear those monthly. So there are things that we were worried about, but as systemically we have advanced, we have been able to overcome those. There's a lot of training that goes along as well. One thing that we have come up with several years ago is a zero tolerance policy, which is you can only access cases if you have a business need. And we have reports, and it's kind of big brotherish, to be honest with you, but we do have reports that indicate whether or not you've accessed a case that you had no business in being. And we ask supervisors to verify those. I think that was the biggest issue for us. And then we also have things like productivity reports to see how much time a person spends from home, and we monitor spends from home working in the system, and we monitor those as well.
Thank you. And then I think one last question, and then we'll wrap up here. I believe you said at the beginning of your presentation that your division or agency also oversees unemployment. And I'm wondering if during this time when we're seeing such a surge in unemployment applications, if you guys have connections built in between unemployment and Medicaid and SNAP and other programs to get people connected to any program they may be eligible for.
Yes, as a matter of fact, I think that's kind of been the beautiful thing about being under the same umbrella. The data they have is readily available to us, and we share it. For example, we have an unemployment interface, and if a person is receiving unemployment, we do a monthly interface, and that information is posted to our system without the worker having to request it. And we do the same thing for income. We use currently Equifax, which is maybe a cuss word in some circles because they like to charge an arm and a leg for their services. But basically, being with unemployment and a bunch of other divisions, for example, we do work requirements for SNAP cases, ENT and ABOD. We also are considering implementing work requirements for our Medicaid. Having that in-house with another division makes that coordination piece a whole lot easier. So absolutely, it has been a blessing to have those agencies under the same roof, and it allows us to collaborate on serving our customers best. So we have a lot of information that the customers have lost their job. Our workers know about things that are happening in unemployment. I mean, I can tell you that in the last month we have received three more applications than we have seen in the last 3 years combined. So what we also know is as those benefits are exhausted with unemployment, we can plan for increases in workload for us because we kind of get a heads up from employment saying, hey, we're seeing a large number of people drop off. That means that if they're not being reemployed, they're going to be coming for public assistance. So there's many benefits of having those under the same umbrella.
Great. Well, I want to say thank you both to Jen and to Maurice for the presentations today. One quick thing before we wrap up, Patrick, I saw your clarifying question from your question you submitted earlier about CHIP, asking if there's a waiver for a CHIP telephonic signature. And to Jen and I's knowledge, there is not, but if we see something to the contrary, we will let you know. So we are at the hour. I want to thank everyone for joining us today. If you have other questions that come up after you sit and think about this information for a while, please don't hesitate to reach out to Jen and I. And we will send out a copy of the slides along with a link to the recording of the webinar. So thank you again, and I hope everyone has a wonderful rest of your day.